I guess I've seen the awareness of health care and the importance of health care from my involvement as a classroom teacher of children with special needs, all the way up to my administrative experience as an elementary principal, taking a couple of my students to the doctor when they were ill and didn't have coverage and trying to arrange care for them. One of the stories that we have is of a child who had a chronic asthma condition at our school. The child did not always have access to care to manage their asthma, and what ended up happening is we ended up taking the child twice to the emergency room over the child's protests. They were very concerned that mom was going to be angry with them because they were going to the emergency room for care, and that was another bill that parents would not be able to pay. And I've had the opportunity as an elementary school principal to get to know a lot of the families and their circumstances that they're facing. One of my students in an unfortunate situation where there wasn't access to good health care came to school and was running a high fever and was complaining a lot about her throat hurting and her ear hurting. And so I ended up taking her to a doctor. I called my child's pediatrician and said, would you see? And got permission from the parent and took the child to the doctor, paid for her care out of my pocket, because it's heartbreaking to see a child suffer. And I think that it's a shame that parents have to sometimes make those choices between getting health care for their children or paying for unexpected bills. And I think one of the beauties of this particular healthcare reform is parents won't have to make those choices for their children. Their children will be able to have access to preventive care, to stabilization medicines, to a regimen and a routine that will help them avoid getting in a crisis situation such as the one this child experienced.